that started 10 years ago. So, as the saying goes, all ships rise with the tide, and I think the tide is about to rise again. 10 years ago, as we put together our original mission statement, it actually included the following objective. There was 5 major ones. This was the 5th. We've accomplished 1, 2, 3, and 4. The 5th, and I quote, part of it was to bring together healthcare professionals of traditional and alternative medicine. We think it's time to embark on this goal in a more serious manner. Now, I said I'd come back to my earlier slide of our new healthcare facility. In April of this year, we opened our first clinic for DoTerra employees, and we're using rented space right now in Pleasant Grove. This was the first step as we wait for our medical building to be completed, which is expected to be finished for move-in by early April of next year. When this facility opens, it will be available to the community as well. Now, besides its primary use as an integrative medicine clinic, this 41,000 square foot building will also include urgent care services and will include an in-house imaging center. Now, I'm excited to share that DoTerra's healthcare initiative now has a name. You want to know what it is? All right. Prime Meridian, because besides allopathic medicine, I should say, it will embrace an integrated or whole person approach, including alternative and holistic modalities, nutrition, healthy living, similar to our health pyramid many of you are already familiar with. Now, it's no secret that in the United States, our healthcare system is facing a huge financial crisis. It's become a crushing financial burden on families and employers alike, frankly, and quickly is becoming unaffordable by many. Insurance companies now heavily influence standard of care, often telling physicians what they will and will not reimburse in way of prescriptions and other modalities. Medicine has become very episodic in its approach to wellness, with very little done in way of prevention. Now, as the name Prime Meridian Health Clinics implies, just as East meets West, and the Earth's prime meridian, this organization seeks to combine allopathic and holistic medicine in a truly integrative care with you, the patient, at the center of the experience. You get the idea? So, there are 4 primary objectives that we hope to accomplish with these new clinics. First and foremost is to provide an integrated approach to healthcare using both allopathic and holistic solutions, with essential oils being the major focus of the latter. Second is to lower healthcare costs significantly, and I mean significantly. Third is to improve accessibility and ease of access to medical care. And finally, we hope to improve the overall healthcare outcome by focusing on healthy living, with greater focus on treating the whole person. Now, why did we need a new name for these clinics? A couple of reasons. First, data gathered by the operations from these clinics will be powerful and influential. For the data to maintain objectivity and credibility, it cannot be directly tied to an entity that may be viewed as receiving financial benefit. Second, the success of the financial model for providing healthcare will be equally as impactful, as you might imagine. Providing that superior healthcare with better outcomes can successfully happen for significantly lower costs than our current healthcare system provides. That will be probably one of the most impactful things. Prime Meridian clinics will follow what is called a DPC, or a direct primary care model. I apologize, I'm fire hosing you because I have a lot of information and no time actually. This value-based approach allows patients to receive all primary care visits that they need at a low monthly price, much like a gym membership fee. This will be very affordable. We are also working with partners to secure coverage for catastrophic medical needs. This will also be at a much lower monthly cost than is typically charged in our current system, in the US anyway. So, awesome. This means doctors are paid directly by their patients, not the insurance companies. Right. Because providers spend less time dealing with the complex coding and insurance billing, they have more time to treat you as a person, much more time. Of course, our physicians will have training and be very knowledgeable in the use of essential oils and can incorporate them into your health plan as desired and recommended. We are also ready to announce 3 more locations in the US that will be open. Some by the end of this year, all by first quarter of next year. Do you want to know where those are going to be? Well, you're going to have to wait until this afternoon, and Dr. Hill will tell you, okay? I had to leave him something. We will be announcing more cities in the next couple of months, and as we fine-tune and perfect this model, our intention is to open dozens and dozens of these clinics across the United States and throughout the world. Yes, you heard me correctly. We will be announcing very soon prime-rating clinics outside of the U.S. as well. So, stay tuned. Now, again, some of you are wondering, what do these clinics mean for you and your dreams as wellness advocates? First and foremost, we hope to bring these clinics to you where you can receive the excellent care with physicians having time to focus on you as a whole person. In addition, these clinics will act as an introduction and further validation of essential oils for many of your customers across the country. Of course, only DoTerra's oils will only be used in these clinics because of their consistency in quality standard and the powerful efficacy. As the world understands the wonderful benefits of essential oils and this spreads, these clinics across the country will also spread. DoTerra oils will become, and they will continue to be available only through the direct sales channel, meaning you. Commissions will always be paid on every bottle sold. Doctors in the clinics will not be able to participate in these commissions, as it would be a conflict of interest and potentially violate other regulations that they are under. Just throwing a lot of information out here, I know. In time, these clinics will become a significant additional validation of essential oils and other holistic modalities. However, we will not forget that the greatest education happens from people sharing with people. That is how it works. That is the magic. All right. Lastly, I'll add here that we will be required to go to a much further extent in our evidence-based scientific research of the essential oils. This is also a significant part of our plan, and some of which you will hear about later today. Very great, good stuff this afternoon. I love this quote: policy changes, technology advances, and structural shifts have primed the healthcare industry for upheaval, disruption, and incredible opportunity to advance standard of care worldwide. DoTerra intends to play a part in this, and that means all of you. Now, ultimately, over the last 10 years, it feels like we got a lot of things right, and I'm sure, suppose to some extent, we were also a bit lucky. Many people were beginning to see the harm of chemically laden products, and instead we're seeking to return to nature and its purity. A lot of that's going on today, as you know. Not much compares to doTERRA's essential oils in this regard in their ability and power to bless lives, so many lives, in so many areas of the world, and some of which I've touched on today. Now, while I'm not sure it's entirely deserved, doTERRA has been given credit for creating literally a whole new industry, essential oil industry. And we intend to keep our position as the gold standard. So, as we have so much to share in the next 3 days, today we are poised at the beginning of another wave. More and more individuals are becoming appreciative both of the powerful benefits of essential oils and perhaps some of the distinct limitations of our current healthcare system. doTERRA is about to differentiate our amazing essential oils again. It feels to me like another wave is coming. And fortunately, many of us have proven to be pretty good surfers. Now, I hope everyone here will be inspired to embrace their dreams as we all prepare to catch this next wave. Thank you.